Hello everyone and welcome back to the Medcurity podcast. Let's talk about 2025 and why it is shaping up to be a big year for cybersecurity in healthcare. The HHS Office for Civil Rights has proposed updates to the HIPAA security rule. If you're familiar with HIPAA, you know that it hasn't seen any major changes in years, so this is a big deal. Before we talk about the proposed updates, let's take a step back and talk about what the HIPAA security rule is and why it matters. It's one part of a larger framework that's designed to protect sensitive patient information, setting the minimum standards organizations must meet to keep electronic protected health information, or EPHI, secure. Now, the rule focuses on three areas: administrative safeguards, which cover policies and procedures, physical safeguards, which address securing spaces and devices, and technical safeguards like encryptions or firewalls. These are the building blocks of protecting patient data and ensuring compliance. Why does this matter so much? First, it builds trust. Patients expect their data to be protected, but it's also a financial issue. Data breaches are expensive, and compliance is a key part in avoiding those costs. Now, the security rule was introduced back in 2003. While there have been tweaks here and there, this is one of the most significant overhauls we have seen in decades. It reflects just how much the cybersecurity landscape has evolved. Think about it. Back in 2003, ransomware wasn't a word that people had heard of. AI-driven phishing attacks weren't even a concept, but today, those threats are not only real, but increasingly common. For organizations, this means that compliance is no longer just a checkbox. It's about embedding security into the very fabric of daily operations. Now, that's why these updates matter. They're not just about keeping up with regulations, but about keeping up with the reality of today's threats. And that brings us to the proposed updates. What's new, and why are these changes so important? For starters, encryption would become mandatory for all EPHI, not just a suggestion. Multi-factor authentication, something that many organizations are already using, would also become a requirement. And compliance audits, these would need to happen regularly, giving organizations less room for error and more structure for staying secure. Now, these updates are still in the proposal stage, but they're expected to make a noticeable impact on how the industry operates. It's no longer just about ticking a box on a compliance form. Organizations will need to rethink their security strategies, update their systems, and make sure that their staff are trained to handle new requirements. And it's not just because of the regulations either. Cyber attacks are becoming more sophisticated every day. Hackers are now using AI to craft phishing emails so realistic that even the most cautious employee could be fooled. The stakes are higher than ever. But these changes aren't just about reacting to threats. They also are about being proactive. This is the time for healthcare organizations to look at their current setup and ask, are we ready for what's next? Incident response plans, training programs, system updates, all of these are critical pieces of the puzzle. And while these updates might sound daunting, they are really about building a stronger foundation for the future. The goal is to make cybersecurity less reactive and more of a built-in part of daily operations. So be thinking about this in your organization. What's next? 2025 is a year for rethinking cybersecurity. Starting now can save organizations time, money, and stress in the long run. Thank you for listening today. If you are curious about what these changes could mean for your organization, then stay tuned. We'll keep you updated as these updates unfold, and we will continue to provide tips to help you prepare. Stay safe, stay secure, and we'll see you next time.